Hi, Dr. Yass here. I'm putting this post on, and the name of the post is A Herniated Disc or Stenosis Was Found on an MRI. You just got screwed because of the fact that there is this false premise that has been perpetuated over 3 decades that the MRI, in finding structural variations like at the spine, herniated disc, stenosis, pinched nerve, spondylolisthesis, compression, fractures, all the structural variations, that simply by identifying them, that this means that it's the cause of the pain that you're experiencing simply because it was identified at the time you're having pain, is a 100% baseless premise. 100% invalid. How can I make such an extreme statement where the rest of the planet seems to be telling you, nope, that's the way to go. Look at our culture. Everybody believes a herniated disc can cause pain, a pinched nerve, all these type things, and yet it's baseless to believe that the identification of these structural variations on an MRI at the time you're having pain means it's the cause. Part of the culturally created mindset that has been perpetuated on you is the fact that when the MRI is created and the result is read to you and you're hearing these medical terms, that somehow, simply because they've been identified, that they warrant some sort of treatment is just insane. Here's one statistic. Over the age of 60, 90% of people with no back pain can be found to have bulging or degenerative discs. Is the implication that although they have absolutely no pain, by the mere identification of these structural variations, they should get surgery? They have no pain. Life is great. And yet, because these structural variations were identified, that they warrant some sort of intervention? Another study shows 63% of people with knee pain have meniscal tears. 60% of the population that has no knee pain have meniscal tears. Should those 60% get a meniscectomy? Cut out a piece of their meniscus, even though they have no pain. Perfect function. The premise that the structural variation is identified when you're having pain means that it is the cause of your pain is baseless because of the fact that there has to be an extension to this concept. It was found when you had pain, because MRIs are always taken when you have pain. But what if an MRI was taken before you had pain? If this is the cause of your pain based on what they're telling you, that implies that the existence of the structural variation was only there during the period of time you had pain. So if you had pain for 2 weeks, and now it's 2 weeks down the road, now you're taking the MRI and you have a structural herniated disc or stenosis or any of these found, the implication is it's only existed for 2 weeks. They weren't there before, right? Doesn't that make sense? Because if it was there before, why would you think it's the cause of your pain now? It's already been there. You had no pain with a herniated disc, stenosis, arthritis, any of these things. Now you're having pain. Oh, now it just turned on? It's insane. It makes no sense. Now, think about the premise. If an MRI was taken a day, a week, a month, 6 months, a year before you had your pain, what do you think the MRI would present? The answer is exactly the same as what it presented when you were in pain. I would hope there is no medical practitioner on this planet who would actually assert that if someone had pain for 2 weeks, that 2 weeks and a day ago, the structural variation wasn't there. That it somehow appeared the day they had pain. I would hope there's nobody on this planet that would actually assert that. So somebody's going to have to explain to you how, if this had been there for years or decades, why suddenly 2 weeks ago, because you started getting pain, that now became the cause of your pain. It's baseless, invalid, and insane. Let's try to give you a metaphor, a simile, something similar. You're now in your 60s, you have some wrinkles on your face. You've had the wrinkles for 5, 10 years. All of a sudden, you start getting some itchiness in the area where the wrinkle is. Is it to say that the wrinkle is the cause of the itchiness, and therefore you need a skin graft? Would you buy that if someone said that to you? The itchiness that you've had for the last week is caused by the wrinkle, because it's in the area, it's right next to your wrinkle, that you've had for the last 20 years. You need a skin graft. God, I would hope that you wouldn't be willing to go for that. Clearly, it's something else in the area associated with the skin. It's unrelated to the wrinkle. The same thing can be said for your back and your peripheral joints. These structural variations have been there forever. They've been there. They're developing. You do not know or understand the concept of obtaining strength and balance of all the muscles surrounding joints to make sure that the congruency of the two joint surfaces is in exact alignment, so 100% of the joint surface can take 100% of the force running through it, and therefore the full joint is used in its healthy form and nothing happens. You have weakness or imbalance because you're not aware of that. You're doing activities. You get misalignment to the joint surfaces. 90% of the joint is now touching. So 90% of the joint is taking 100% of the force. Wasn't designed to do that. Boom. You're going to start wearing down the joint. Same thing goes for the spine. Herniated disc, stenosis, all of it. It's just variations, structural variations. They're occurring over decades. It's so slow it never even emits pain. They're like wrinkles. How many of you go over a bridge? Look at the bridge. Look how much rust has developed on the bridge. You don't panic. You don't say, I'm not going over that bridge. The reason is because although there's a structural deformation, which is the rust, the structural integrity of the bridge is intact. So you use it. Your spine is intact. Your joints are intact. They're working properly. And as a result of that, there's no reason for the body to elicit a distress signal of pain as a result of these deformations. You must understand this concept if you are ever to have your pain diagnosed correctly. If you are having your pain diagnosed, regardless of the medical practitioner you're going to, through the use of the MRI, you have a 90 to 95% chance of being misdiagnosed. You will never see your pain resolved. In fact, you'll probably have the pain increased. Because if in fact the cause is muscle and you're treating some structural variation, whatever's being done is leading to you having less and less chance to weight bear, which is causing you to weaken more, which is causing the muscles to strain more, which is causing them to elicit pain more. 95 to 98% of you have pain because of a lack of strength output of all the muscles required for you to perform force in terms of your functional activities against gravity, and as a result, your muscles are straining. They either elicit pain, cause another muscle to elicit pain. They can cause the joint surfaces to become misaligned of the joints they attach to, which leads to pain at the joint. They can actually refer symptoms through trigger points. They can actually impinge on nerves, which is what sciatica is, so you get a neurological symptom from a muscular cause. That's it. That's your answer. The reason the existing system isn't working is because you're being misdiagnosed. There's nothing wrong with you. It's not in your head. It's not that someone can't figure you out. No one can be figured out because the wrong system is being utilized. The wrong tissue is being treated. It's time for you to recognize you do not have to live in chronic pain anymore. You can regain your functional capacity. You can reclaim your life. You simply have to get the Yost Method. If there's some question about what I'm saying, are you surprised that I'm the only person on the planet saying this? Don't accept it just because I said it. I would never want that. I want you to look at the information. See if it makes sense. See if there's a theoretical basis. There's no theoretical basis for the use of the MRI. In the majority of cases I talk to or treat people, the actual diagnostic finding of a structural variation couldn't even create the symptom the person's experiencing. And yet they're being told it's the cause. It couldn't create it no matter what. It literally can't create that symptom. And yet that's what's going to be treated. The Yost Method interprets the actual presentation of your symptoms just as the body wants you to. The body has a tissue in distress. It's eliciting a symptom to try to create conscious awareness of the distress of that tissue. The tissue is identified, treated. Body no longer has to elicit the symptom. As a distress signal, it stops. So the interpretation of the symptoms is what helps you identify which tissue it is. In 95 to 98% of cases, it's muscle. Establish which muscles have broken down to elicit the symptom. Do the proper exercises, utilizing targeted progressive resistance exercise, causing the muscles to adapt to greater resistances. That will allow them, all that are required to perform your functional tasks, to have a greater force output than the force requirement of the activity. Never strain, never ignite a pain signal. You're fine. This is the answer. If you want to get more information about the Yost Method, go to the website, look at my blog. Lots of posts, www.mitchellyass.com. Go to my Facebook page, Dr. Mitchell Yass. Go to the YouTube page, Dr. Mitchell Yass. If you'd like to contact me, you're questioning now. Now something's starting to make sense for the first time in your mind, and you're saying, oh man, maybe there's hope. Maybe there's an understanding. Somebody out there has a sense of understanding how to interpret my symptoms. Contact me through my email address. Dr. Mitch at mitchellyass.com. DrMitch at MITCHELLYASS.com. Call me on my cell phone, 516-449-1359. I can't make this any clearer. Nobody should have to live in chronic pain. When we talk about systemic disease, cancer, MS, that's one thing. But pain at the neck, the back, the extremities, never. You're being misdiagnosed. No one's identifying the true tissue. If you've gotten a procedure and the symptom continues or persists, by definition, it means the wrong tissue's just been treated. You must recognize that. If you're getting some sort of mechanism to mask your symptoms, epidural nerve blocks, cortisone shots, radiofrequency ablation, rhizotomy, any of this stuff, medication, all of it, it's the medical establishment's attempt to say they raise their hands, they give up. I can't identify the cause. That's what it means. I'm now just going to work on trying to mask your symptom. You don't mask someone's symptom if you could establish a cause and resolve the cause. It's time for you to make a change. This is your chance. You hear this, you see this, learn about the Yost Method. Understand it. Understand the theoretical basis for it. Then when you're ready, contact me. We'll create a plan. We'll resolve your symptoms, give you your life back. You'll forget this ever happened to you. This is your chance, okay? So contact me however you want. Get the information, understand it, and recognize why when I say you had an MRI, it identified a herniated disc stenosis, you just got screwed. Now you'll understand why. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.